Good evening, everyone. I'm Dr. Basil Considine, and we are here today for Writing as a Nurse Policy Briefs. This is a targeted webinar where we're going to be looking at a specific assignment that you'll encounter as part of the DNP course sequence, and we are going to focus on that today. If you are interested in information about how to make an appointment at the Writing Center and other services, watch just about any other video and we'll talk about it. Today we're going to dive right in. And the only thing I'll do here is mention that not only do we have a lot of related webinars for students in our nursing sequence to attend, but we also have a recently updated catalog on the website, and this is just a small portion of the course tie-ins that we have for different webinars. So if you see something on this list, go ahead and check out the Writing Center website, and we're always expanding this with new webinars every semester. All right, so we're going to start by discussing a genre called the policy brief. And policy briefs are something that are increasingly a task set in front of nursing leaders in clinical environments, in hospital administration, sometimes just with a small group of colleagues where you are tasked with, okay, prepare and present some information. And so we're going to delve into this. And the purpose of a policy brief is almost always to make things better. Sometimes it'll be focusing on a more short-term goal like drive awareness of a problem. But ultimately the big picture goal is to influence positive change. And there are a few ways that this genre really delves into that. One, the policy brief is designed to engage and inform the target audience, which is almost always going to be non-specialists, people who would not otherwise be reading, scholarly journal articles on it. And they're highly focused on a specific issue. And because of that focus, they only spend time on the aspects that are being examined in detail. And that is a crucial element of writing a concise policy brief, that you understand and articulate what that very specific focus is and what aspect of that you will be delving into. These are professional documents, but not academic in the sense of, policy briefs are usually not, filled with the paragraphs all anchored in citations. Your kind of end readers, they'll want to have references, so know that you're not just making it up, but you're also not encumbering it in the same way as the flow of ideas would be interrupted by parenthetical citations when writing in APA style. Now, there's also an emphasis on being engaging, accessible, and understandable. So there's a fair bit of so-called plain English that goes into writing these, but it's also very common to see it supplemented by charts and things like that that help make complex information more understandable. Some of the key elements here of any policy brief: the title, the executive summary. Think about this. You're meeting with a bunch of people. The executive summary is how they quickly remind themselves, okay, yes, this is what we're discussing today. So this is a short intro to what you're talking about. Give the rationale for action on the problem that's identified, probably identified in both the title and the executive summary. What are you proposing? Like, what should be done? And to really give a informed discussion of what should be done, you want to identify or propose the different options that are on the table, and then state why your recommended course is the best, or why you're recommending that for your particular institution or area or whatever the context is. And you want to have lists of the sources that you consulted or that you refer people to for further detail, and ground it in links to original research. Now, whether your policy brief is being delivered as a electronic PDF versus a printed document may drive some formatting things here. If you're giving links to the original research or analysis, then it's more likely that there'll be a section of links at the end. If you're delivering as a PDF, which can have hot links that you just click on and it takes you to the resource, then it's very easy to add that. And then, of course, the contact details. If someone gets a copy of the policy brief and wants to get more information or to hire you to help with their implementation, uh, you know, have your name on it and your contact information, or of your organization, as the case may be. Now, as you go about doing this, I do want to remind you, please don't recreate the wheel or intake form. We've got a AP course paper template. I strongly recommend using it to save time. And that's what we'll be expected to be using for the basic formatting of the policy brief paper. Now that we've talked about policy brief papers in general, let's focus in and talk about this specific assignment. So this is the week 2 assignment, the policy brief paper for Nursing 721, which is healthcare policy and clinical practice. So this assignment asks you to research the history of the problem that you're recommending. So before we go in, we need a problem. And there's related discussion for this course and everything, but we need to identify a problem that this policy brief will be approaching or addressing. And so once you've identified that, then you go in and research the history of this. You're giving a recommendation. So the recommendation is about addressing some part of a problem. How long has it been around? What has been done to try and solve it? And consider, well, what do stakeholders recommend should be done? And are there any groups, nursing and others, currently supporting work to implement policy changes? And from that research, you prepare and write the actual policy brief, in which you are required to first summarize the problem and why your audience should care about this issue, which does mean that we need to define who the audience is. Examine the current status in the health policy arena. Analyze the background to this issue. Appraise the history of the problem behind the recommendation and what is being done to try to solve the problem. And what do the stakeholders recommend should be done? Are there any groups, nursing and others, currently supporting work to implement these changes? And what do you recommend for policy change? Okay, once the recommendation has been made, analyze it. What do you predict will happen? What will the impact be from the perspective of consumers, nurses, other health professionals? This could include PAs, physicians, and so forth, and additional stakeholders. I also want to elaborate on the potential economic benefits of the recommendation. Is this going to save costs in some shape or form? Final conclusions, and then a detail of the resources used to create the policy brief. So if we go back to the earlier slide talking about the general components of a policy brief, that numbers 6 and 7 in this list of key elements is being encompassed here in that detail list of the resources that were used to create the policy brief. All right, so let's check a look at the rubric here. And we see that this is pretty much listing all the elements we were talking about earlier. And we can see some idea of how long these sections should be in relation to each other based on the points. So recommend a policy change, that's 10% of the credit. And detail the resources used to create the policy brief, that's 10%. So overall, that's going to be a fairly small proportion. The list of the actual recommendations will be short. The analysis of how they'll be impactful and helpful, that will be much longer. Just looking at the points, with 4 times as many points, you can guess it's going to be a couple times longer than the list of the policy change explaining what it'll do and how it'll work and why it's so great. All right, so there's something that's not actually addressed here in the rubric, and that's not addressed in the assignment instructions, at least not directly, which is how long should this paper be? And here I refer you to one of the readings for this week. This is the report put out by the International Center for Policy Advocacy. And it has a lot to say about how long a policy brief should be and why it should be that length. And one of those things is, what is missing are shorter, more practical communication tools that can engage informed, non-specialist audiences. So in this case, they're talking about writing a policy brief, with the emphasis on it being brief. And then later on in the same document, you'll find a variety of things that will help give some ideas for how to fulfill the elements of this assignment. Targets an informed non-specialist audience and examples of who you might be writing for, such as decision makers, NGO that's non-governmental organization, advocates, journalists. Audience driven, that your specific policy message is designed to engage and convince key stakeholders. So, for example, if your policy brief was about, oh, here's this issue that needs to be brought to the attention of the general public, here, you might be writing your policy brief for journalists to try and encourage them to write about it, or you might be writing your policy brief for politicians because you're trying to influence how they vote on things and what policies or legislation they draft. And those are going to be two very different audiences. So make sure you're specific about which one you're writing to and then customize accordingly. Should be used as a tool to support advocacy activities in order to start a conversation or get the interest of those non-specialists. So for those who are willing to dive deeper, you want to have those resources, those links or list of references you used. And you are going to be only including the key findings from the primary research, from the original research that you reference. Just a reminder, should be clear and simple. And here we are at last about that question, how long should it be? It says 4 to 8 pages as your target length. Now, just to be clear, as we adapt things to our APA course paper template, let's not count the references list. Let's not count the title page. That's 4 to 8 pages for the content of the policy brief itself, including your recommendations, the executive summary, and all that stuff. Okay, so at this point, it's probably a good idea to look at hands-on how we might be arranging this. So this is a point where I will go ahead and I will prepare a copy of our APA course paper template, and we will use that. I will share that screen, and we'll talk about how to go from looking at the instructions to drafting the outline. Now, one of those questions that comes up immediately is, what should you title this? And that's a question where there are two answers here. One of those answers is, well, you want to have a really catchy title, something that gets people's attention, and that's not bad. But it's also more than you need for this assignment, because we want to write a policy brief and present it. And if you communicate clearly what this is about, that is enough. So I'm going to ask now for a recommendation from the room. If you could name a issue that you might possibly be writing a policy brief about. Okay, got a suggestion. The suggestion is violence against healthcare workers. So let's say that let's say we started with this as our title. Policy brief, frightening increase in attacks on healthcare workers. Now, this is where we have one of those know your audience situations, because if we were just writing a regular old paper in APA style, you wouldn't use frightening because that's subjective. But the policy brief is designed to reach that non-specialist audience. And so it's not as strict in some senses as a regular paper title might be. Now, if I was a journalist and I've received a brief that says frightening increasing attacks on healthcare workers, I would probably say, oh my gosh, it sounds terrible, and read it out of morbid curiosity and see what was going on there. So you may want to have a title that is a little bit subjective and colorful. All right, so I'm going to go ahead and I'm going to go grab some pieces of the assignment instructions here. And by that, I mean I'm going to grab the exact instructions on preparing a policy brief, and I am going to copy and paste them here and use that to create an outline here. So by just pasting it here, I have a idea of how this information is supposed to be organized, and I can go ahead and just start writing text after each of these here. So let's say I'm doing this one. Now, do I need to be writing complete sentences while I'm starting my outline? No, I'm just taking notes for myself to see how this is going to develop and get an idea of what I need here. But this is probably something that I can write about in detail. And unfortunately, this is a very real problem in some parts of the country where frustrated people, especially during the COVID pandemic, have been taking out their frustrations in a really not good way. So, this is something where you can probably write a statement about this off the cuff. Now, if I just write it this way, if I just say patient and patient family members attacking healthcare workers has increased significantly in the United States during the COVID-19 pandemic, this sounds just like a factual statement. And while it's certainly unfortunate, uh, it's not presented as this is the problem or this is the issue that's being addressed, in part because that word is not used. And so looking at this, say, okay, well, how do we make that more clear? And the answer is, well, we use that term problem and we specify who it is a problem for. Okay, this increase creates a safety issue, presents a significant problem to, and then we define who we're going with. And this can go in different directions. Not to say that it's only these, but you'll write a different paper if you're writing to rank and file in an emergency department versus you're writing to the administration versus you're writing to human resources. So for our purposes here, let us say that we're addressing nursing retention, which is a big problem across the board. And frankly, uh, if you're working in a setting where people are attacking you, that is not going to make you want to keep working there. And we want to be specific. So don't just say underserved areas because that can mean many things. Let's focus in on medically underserved areas. So now we have a phenomenon. We're saying, that phenomenon is a safety issue, and that's a significant problem for trying to do this. And so now we've got the summary of the problem and why the audience should care. And the audience is presumably related to people who want to retain these. And that can be many different stakeholders across a hospital or other clinical site. All right, so examine the current status. Okay, well, let's make some notes about what to check. Has there been a lot of documentation of this? Is there public awareness on this? And by asking these questions, we can establish, okay, what is known? Like, is there a lot of literature saying this happens? Does the public know about it? Are there clear guidelines or recommendations for what to do? Essentially, this is the, okay, well, here's where we are now. And this can be very different in area or depending on the resources. So, for example, when I was teaching in the DNP program at the University of Tennessee, Chattanooga, Chattanooga is this community, this metro area that is right on the border between Tennessee and Georgia. So, nurses might go south towards metropolitan Atlanta. They might go north towards Knoxville, west towards Nashville, stay in Chattanooga, or even head out to the Carolinas. All those are possibilities for mobility there. Now, because of that, that means you can recruit from all these areas and you can potentially lose to those areas. And that's not all a bad thing. You have people who want to move to the city or want to move to a quieter area, more elbow room, or something like that. But your context may create a significant driver there. So, for example, if we were talking about having this issue in Hawaii, where it is geographically constricted, it's small in terms of the geography. Land is very expensive, cost of living, perhaps some cultural barriers for people. And also, you don't have a lot of nursing programs there. So this is one of those things where the local conditions may be a big part of your defining what the current status is. Now, it happens that Hawaii has many established Asian communities which facilitate people from certain countries coming in, but you want to account for all these things and describe the current status, the general arena, and your specific context. Analyzing the background to the issue, you've got a series of questions to answer here. And just say, when you're filling in your outline, you might find it easier if you take some text and you either italicize your text or you bold the outline stuff so it's clear where you're filling things in and versus where you just listed the instructions. I'm going to go with italics for now. And looking at this, okay, so history of the problem, and what have we done, and are we talking about the industry or about our institution here? I spent some time at Mass General Hospital in Massachusetts, and they had security people with tasers in the emergency room sometimes. It's not an environment where you want to do it, but it was a response. And so that would be part of their history of the problem. That their solution was to have people around who had some training and specialized equipment and things like that. And, they have since tried to head things off in other directions here. But ultimately, the history of the problem does include what's been tried, and there may be reasons like it didn't work, or it created bad publicity, or it did the equivalent of pouring gasoline on the fire and escalated things. And there are all sorts of reasons why that history may inform and potentially complicate things that you are recommending to do. All right. Any groups, nursing and others, currently supporting work to implement policy changes? So this is one of those things where you want to know and identify in the policy brief who's got a iron in the fire, who is working on this already, and who would you naturally want to enlist to make this happen. And in any healthcare environment, there's going to be some diversity, whether we're talking, say, going down to the phlebotomists who get called in to assist sometimes, or who can de-escalate situations, or the CNAs, or the attending physician, whatever you're happening to recommend here. All right, recommend the policy change. Now, we saw in the rubric that the recommendation is only 10% of it. So this shouldn't be paragraphs and paragraphs. This is probably going to be a succinct recommendation in a couple sentences and a couple more sentences to elaborate on that and explain and exactly what you're recommending. Then we have the analysis, and this is going to be a substantial portion. And if you walk through each of these groups in turn, so, okay, well, consumers. Now, I think one of the options that has been tried in some places, I won't name the healthcare facility I was at that did this, but one thing they did, they were located very close to a major police station, and so they tried involving law enforcement. And let's just say that arresting patients' family members was not the best thing for long-term patient happiness here. So for what are labeled here as consumers, the patients and their families, you might have a recommendation that works very well at making the problem go away, but then makes the patients go away. And yeah, there are lots of factors here, and that's one of the reasons you want to write a policy brief, because it's a complex issue that you are addressing. If it was something where you could just say, oh, we'll change this one little thing and it'll solve all the problems, you wouldn't have to write a whole brief on that. So, all right, so consumers, nurses in particular, other health professionals, and additional stakeholders. When in my time at the Boston Medical Center, that is a center that was formed essentially by merging the School of Public Health, the School of Medicine, the School of Dentistry, and at Boston University with Boston City Hospital into this elaborate entity. So that this is something where we have both civic and private stakeholders, and the general public is definitely a stakeholder in this. And what the public has in mind can be very significant, especially if it's something where your particular recommendation has to do with lobbying. All right, now it says elaborate on the potential economic benefits and how the recommendation may contribute to controlling healthcare costs. So again, this is going back to what is the issue and how are you quantifying that? Now, low retention has its own costs, and there are lots of articles out there that do delve into this. So you don't have to recreate the wheel if you're going with something like that. You just need to identify the literature and see, okay, so what's the scope of this problem as it is now? And knowing that, what are the potential benefits of addressing it? And then the final conclusions and detailing the resources to create the policy brief. Now, if we're doing a length of 4 to 8 pages, which is the range that is recommended in that piece of reading that I was talking about, then we have a couple things that we want to keep in mind. One of those is that if we are looking at this question of, okay, what does the rubric says? Okay, the rubric doesn't give a page length, but if we're using 4 to 8 pages and we say, okay, well, approximately a 10% of that is going to, for example, recommend a policy change. We say, okay, well, what's 10% of 8 pages? We're talking somewhere around 2 substantial paragraphs. So if the recommended policy change, if the upper limit is 2 paragraphs, not quite a page, then we see, all right, then we're probably talking maybe a page and a half maximum for these sections that are marked summarize the problem with 2 points. So I would say recommended policy change is probably going to be 1 paragraph and 2 at the long end. And at these other sections, we're probably going to have at least 2 substantial paragraphs, probably 3, maybe even 4. 5 would definitely be excessive. So I'm going to recommend that most of these sections ends will be 2 to 4 paragraphs in length, but recommend a policy change will be the shorter one. You can also take this opening, summarize the problem and why your audience should care about this, examine the current status. That really does break down into 2 separate things. So, if you have a good substantial paragraph or 2 on each, then that it will put you in the right ballpark. Okay, I hope that was helpful. And if you are looking to get some advice on a draft in progress, you want to check, is the voicing appropriate for your identified audience? Feel free to contact us at the Online Writing Center. We are here to help. Have a good evening, everyone.